Recording in progress.
Welcome everyone. Thank you for attending today's webinar. My name is Donna Chow and I'm your host and moderator for today's class by eLotus, your leading provider of TCM education. Today's webinar is Understanding Jimmy Chang's Clinically Proven Formulas Part 6, presented by Dr. Jimmy Chang. There's going to be one break today and we are set to end at 4:30 p.m. For lecture notes, if you would like a copy for yourself, you can go ahead and download them from the Blue Course Access page in your account. If you would like to chat with your attendees, with your colleagues, you can go ahead and please set your chat preference to everyone so that everyone can see what you're typing and also be part of the conversation. If you have any questions for Dr. Chang, please type your questions directly into the Q&A box because it can get lost in the chat room and Dr. Chang may or may not see it. And finally, the quiz and video replay. You guys will all be notified by email tomorrow once they are available. So look out for that. It's usually available in the afternoon. All right, so our speaker today is Dr. Jimmy Chang, a doctor of Oriental medicine trained in Taiwan and a licensed acupuncturist in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise in differential diagnosis and herbal prescription. In today's class, you will learn Dr. Chang's pulse sign, as well as tried and true formulas for cancer symptoms, hemorrhoids, cough, asthma, allergies, and insomnia. Dr. Chang has previously taught with us on a number of courses, which are now available for purchase as distant learning CEU videos. If you want to be able to feel a patient's pulse, identify the Western medical diagnosis, and create clinically effective herbal formulas, Dr. Chang is the person to learn from. For learning his pulse system, we recommend the Gold Pass because you have unlimited access to his pulse courses and herbs for a year. With the Gold Pass, you can also try the herbs he mentions because our sponsor, Evergreen Herbs, will provide you with an herbal voucher. When I get back to my computer, I'll post the link for you guys so you can learn more. Now let's begin today's class and welcome Dr. Chang.
Okay, you're on.
I'm on?
Yeah.
Hi, guys. Can you see me now? Oh,
Now,
I don't need a microphone? Mhm.
yeah, you see.
Hi, can you see me now? Okay. Today is November 9th, 2022. It's me again here and talking about something rather interesting. I never talked about it before, ever. So let's begin with the first chapter. Cancer combo, okay? Okay, before we talk about the cancer combo, there are several very interesting processes about finding out the I need a new page.
You want a page? Yeah.
There's no way to add a new page.
You got a page. Yeah, you got a page.
Oh yeah.
You just have to do this and then you have to add it.
Okay.
And then you share again. Okay? Right? You add a page first and you share.
Yeah, here.
Yeah. Then you do open it up again. Make your full screen.
What?
There is this, so add something here. You don't type anything or no?
Maybe.
Typing? Are you typing?
Hold on, write it.
Ready? Okay, make it bigger. Then
Okay.
you can share this on. I'll share this on for you. Sorry.
Okay.
You write it with this thing if you like.
But
You want to add that?
let's talk about some we call a dead pause, pause of death. If you can encounter any kind of a pause like this, it could be something bad. First is the feather pause, especially on the right swing. Here, the so-called feather pause is very, very light on the surface. When you gently touch, that's what I always emphasize the techniques of taking pauses. You have to be very light in the beginning, at the beginning. Don't press down the vessel too hard. And that way you're gonna miss it. So just when you touch, especially when we started with the right swing, you have to touch it very light, gently touch the skin. If you feel anything, okay, there is something. But when you press down, there's no rebound under it. So weak. When you gently touch it, it just totally collapses. It's called feather. Feather means it's so light, no support underneath. Like you touch a piece of a wood, the wood floating on the water. When you press down, there's no rebound from underneath. So it's very, very weak, like touching a feather. That's called feather pause. That's the dead pause for lung, possible a lung cancer. Okay. And the second one is, doesn't matter right or left, it really doesn't matter. The problem is it's a being pause. It's not like the short pause we've been talking about before. It's like sometimes we'll feel a short pause like this or somewhere that like that. But when you press a little bit harder on the short pause, it just disappears or something. But for the being pause, the being means it's so hard, you cannot press it, you cannot make it disappear. Just like a real being buried under the skin, somewhere that can be anywhere, anywhere, 寸关节 or anywhere. And that's the death pause of the heart. No, actually, it got nothing to do with the heart. It's the blood, some kind of a tumor in that related area. It's gonna be very hard. No matter how hard you push your finger down, you could not make it disappear. That's the being pause, and that's one of the death pause. And the third one on the left, what? Here, like a blade pause, like a very sharp blade, like the blade of a knife. That's called, we call it what do you call it? The severe constriction, very, very thin and very, very hard on the left one. And that's the dead pause of liver. That's the most severe condition of liver cirrhosis and liver cancer. So it's sharp. It's very sharp, and down there, just you might feel it's cutting your hand, cutting your finger, like you touch the edge of very hard blade, a knife, or even the paper cut. You feel that it's very, very similar like this. And sometimes I describe it as the thinnest string on the guitar, the thin and tight on the left one. That's the so-called the jin invade the wood. That means a severe constriction. That's the dead pause of liver cirrhosis or cancer. And 齿 both a very long and wiry pulse like this on both. That's we call the kidney fire. Kidney fire means hormonal imbalance. Sometimes if you both hands have this kind of pulse on both hands area, that means female uterus or ovarian cancer or something like that. I noticed this a long time ago. Once I told a lady, she's the wife of a doctor. She came from Tennessee or something, both hands like this. I told her, be careful, you are in a high risk group of getting some kind of a cancer in the female part or even in the breast. I didn't know how to read the ear signs for breast cancer at that time. But anyway, I told her that you have something wrong with that. Be careful. She told me that she just had everything checked. Everything's fine. Okay, fine. Go home. And then the next time she was in my office, she told me, I already have this breast removed. Because after you told me that, I went home and have a double check and they found something and they had it removed surgically. So this could be anything, could be the breast cancer or cervix cancer or ovarian cancer. Anyway, it's for female part. We have 5 organs, but I only know the 4 of them. Okay, let me review it again. First one is the right cun. Right cun, very floating, we call it the feather pulse, very, very light. There's no rebound underneath. When you press down, it just totally disappears. So it's like a feather floating on the water and there's no support. When you touch down, it just disappears. If things like this happen, it could mean lung cancer. And the second one is like a beam, very hard. No matter how hard you try to press it, it could not make it disappear. It's like a really solid beam under the skin. That's the blood cancer. Sorry. Or any kind of a tumor in the related area. Sometimes in the spleen, something about the positioning, how to differentiate which part the tumor is based on the positioning. But I have come up with some kind of a new positioning with a different explanation. I'm going to talk to you about it today. It's different, totally different from my traditional distributions. And the third one is the guan, left guan, the liver area. It's very thin and very tight, just like a blade, like I feel like the edge of a very sharp knife, only in left guan, very deep. So if you find this, it could be the death cause of cirrhosis or liver cancer. And the fourth one is the long and wiry pulses, long past the chi area. Cun, guan, chi. Okay, long past it. So this 4 pulses, if it ever happen, that means something bad. And how do we to make sure is if there is something really bad, let's do this. Any questions so far? I'm gonna erase it. No? Good. Okay, one question. No time to repeat. You can watch the video later. Okay, what's the Sam? What's the next page?
Oh, yeah. So go ahead, close that.
How do I close? Oh, close this.
Close it, yeah, and then you zoom press the slide. Yeah.
No. Okay, you can clearly see those signs on the face. Then, okay. see this spot? You can measure it from draw a line under the nose and on the outside corner of the eye and the intersection here. If you see something there, that's bad. If it's dark, like this gentleman, that means it's like a piece of a dead tumor or something. If it's sometimes you will see a dark spot and something red. That means it's ongoing. It's something with inflammation, the tumor, the cancer cells, something there. But we cannot tell which part of the body has cancer. We just know something bad there. And this one, this lady too, this is not too bad, just a little bit something here. Wait, oh, I have to close this. And this one too. You can see this dark spot. Don't ask me why. I cannot explain. I just know something on this pressure point. If it's something red there, that's the cancer signs. And this all confirmed cancer and cancer. Somewhere inside, I don't know where, but this means something bad. Okay. Okay. So as for the treatment for the cancer, we do not have any theory against it, but this is what I do usually. And the combination is kind of simple. I always use the 乳香没药. Where is it? Oh. Hey. Hey. Hey, Sam, where's the where are the tools? Hmm? Where are the tools?
Two. Oh, the tool. Oh,
Oh,
yeah,
here,
oh,
here.
the tool. Yeah, you have to make the muscle. Yeah,
Eh?
it's really weird. Yeah, like some in the middle. So you have to do like kind of.
Oh,
yeah,
eh?
it's in the middle.
Okay.
Yeah.
In the middle. I always use this 乳香没药. You know, these are the two herbs that was written in the Old Testament of the Bible. The doctor from the Oriental brought this and there's something else to the baby Jesus when the baby Jesus was born. So I use the 乳香没药 as mimetize the whole bad cells in the human body. Astringents for inflammation. And the reason I am using this 十全大补 is for the human own immune system and the healing power. So you can skip that if you want to. Sometimes I just use this too. The reason I'm using this 乳香没药 is not for the pain, not acting as a painkiller. It's just some kind of sometimes like a cement. Or the way, you know, the Egyptians making the mummies, they use 乳香没药 to cover the whole body to make it immortal. It will not perish from time. So it just keep the everything under control, the bad cells. We cannot kill the cancer cells. We just try to hold it and make it steady and work very, very well, many, many times. But anyway, 十全大补 is a funny combination. I cannot remember how I came up with it, but it works. So the proportion will be like this. 35, 35, 30, make it 100. Okay, you can skip the astringent, whatever. 乳香 乳香没药 35, 35, 十全大补 30. Doesn't matter what kind of inflammation there. You just use it and the swelling tissues will go away. And the swell, like I treat several with the leukemia and thyroid cancer. all those things just disappear by 十全大补. I cannot explain why, but it really works. The 十全大补 stuff. Okay. Any questions? Yes. Can it be used as cancer preventative? Yeah, sure. Okay, question. Yes, during the chemo and radiation. Do you know how to identify if the patient is doing a chemotherapy? How can you tell if the patient is doing the chemotherapy or radiation without having to ask? I'll tell you how. Okay, this is the fingernail. If you see some horizontal lines, actually it's a little pale. Something like this. It's called Mies line. It's lighter than the original color of the fingernail. It's lighter. We don't have enough color to do it here, but anyway. If you see this horizontal line on the fingernails, that's the signs of chemotherapy and in a very weak way. So the 十全大补 is so important here. Okay, because Mies line. Any questions? Okay, you have a refund. Don't come back. What will call for the use of astringent? If the pulse is too big and strong, you can use the astringent if you like. Okay. So for the cancer condition is something like this, and the making diagnosis, and this one is so accurate. Just look at people, look at their faces, you will see the dark spot there and dark spot here or here. See, this is all red. This lady has confirmed cancer stuff. The red means inflammation. This is the case. You might want to use little astringent. And this is red too. And this is swollen. So 乳香没药 is absolutely necessary. Okay. How should I know how long? Okay. Somebody's not happy, asking for refund because they cannot register in. Okay, the second stuff for today is the hemorrhoid. Interesting. I'm going to tell you very interesting pause for the hemorrhoid. Do you know how to take a pause to find a hemorrhoid? Okay, this is 寸关尺. Of course, we're talking about right-hand side and on left-hand side. Okay, how to find if there's a hemorrhoid of the patient? We do this. Where's the The right twin is deep and scattered, something like this. Just something like our 缓脉. 缓means scattered and soft and no shape. On the sorry, not here. Here on the right twin. Under the right twin. Soft, shapeless, and weak. That's a hemorrhoid. Don't ask me why. It is just like that. The second cause for hemorrhoid is this. The left, this is the left-hand side. Left, something like this. This is the inchao, remember? Inchao, thin and wiry, just like a guitar string. Like the liver cirrhosis we mentioned earlier on the left one, the death pulse of the liver cirrhosis. And this, if this long and wiry pulse happen on very deep, on the left, sorry, it's called inchao. Inchao means several things: headaches, dizziness, hemorrhoid, constipation, back pain, skin allergy. Oh, so many things from a little pulse here. They can be very deep, or like this, just long and thin and wiry, just like a guitar string. The number 6, the thinnest guitar string. Okay, this is inchao. So these two pulses means hemorrhoid. If you're not familiar with this, this soft and shapeless pulse on the right twin, at this you can see the ear sign. Sam, can I have an ear?
You should be in there.
Huh?
They have one in there for you.
You want a ear?
Yeah.
I need a model easier.
The model is too small, they can't really see it. And, you wanna
How do I go back?
So what you do, like
Can
here,
you put this graph line into the PowerPoint?
this one, yeah.
Copy
Yeah,
and
we'll do
paste.
that one. So we do the copy of this.
Yes.
Go on the slide.
And then you
Oops, sorry.
put any. Okay, and I have ears too.
Yeah.
Okay.
Is that one here?
Mhm.
That's at the bottom. Okay, so you go out. You
Oh,
go.
I'm okay. We got a lot of ears in there already. Sorry.
You have one. Okay, so you
Okay.
go back.
You just keep it.
Okay, put in the bottom.
Ah,
okay.
yeah.
All right. So here, I think you were here, right? Okay, where are you? I'll leave you here then, right?
I was here. Yeah, thank you.
Okay, let me do this. Share it. Share the column. This one.
Okay.
Okay, you erase the drawing.
Okay, you cannot take the pause that, okay, you can see this. This is the ear, okay? Let me do this. This is the colon, the area is the large intestine. If the, see this is the hemorrhoid. Or something blocking the colon. If you see some redness there, it's definitely is hemorrhoid. Something like this already. And here too. See this groove? Groove. Like that, like a wrinkle in there. That means his colon is folding up. So there's a lot of a constipation in there. See the darkness? That's the bad dead stool. And if you see some redness there, that's definitely inflammation and hemorrhoid too. Here. So how do we treat it? Okay, hemorrhoid, just like a varicose veins, it's just swollen with inflammation because people push too hard to get rid of the dirty things out of the body. So all the hemorrhoid will have I'm using this several combination, which is very interesting. It doesn't matter which ear. Okay, where's the, oh, here. Okay, I use 皂角刺 and 陆蜂房 for inflammation and for swelling veins in the anus. And 槐花 almost the same thing. 玄参 also too. Why I use this astringent? Because I want to strengthen up the power to shrink the swollen tissues, swollen colon. And the black one for stopping the bleeding. So put them all together is very effective. And this is the combination for all kind of swelling veins, like a varicose veins on the leg or other veins, or like swelling tissues, like a cyst inside the kidney, or even cyst inside the ear for inner ear imbalance, for any kind of a swelling condition. And today I saw a lady, she had this shingle with a swollen swelling or the inflammation on the skin, and she showed me a picture of her the right side. It's all swollen up, like very swollen, like an islands floating outside. I mean, above the skin, just like several islands, like a Hawaiian island on the ocean. So I use this one, this combination for her. Actually, if you think there's too much trouble, you can just simplify it by using astringent complex. Will help too. But this 4 is especially designed for hemorrhoid, bleeding or not, and even is good for the aneurysm in the head, the swelling brain tissues. I mean, the veins or artery, anything. So this one is a very good combination for all kind of stuff, and good for lowering the blood pressure caused by arteriosclerosis. And astringent is already good for that. Astringent for all kind of inflammation, swelling tissues, including the gout or rheumatoid arthritis, any kind of arthritis, we use astringent. Black one is for bleeding. Black one can be any kind of a tan. Tan means charcoal. Any time, no matter which one you have, that's good enough. So you can skip one if you don't have some of them or one of them. You just keep it. You use the tan for stopping the bleeding. But the most interesting is the 芍药汤. Why I use 芍药汤? Anybody can tell me? Anybody know why I'm using 芍药汤? No. Nothing? Nobody knows? Constipation is a liver condition? What? Making poo? Bring the fire? Clear heat? Softening the muscle? To calm, relax the bowels? Nope. For hemorrhoid. I know it's for hemorrhoid. That's what I put here. But I'm asking why I use 芍药汤 for hemorrhoid. Dampness in the lower jaw. Drain fire, clear heat for damp heat enlargement. Of course. No, it's not for that. The purpose I'm using 芍药汤 is for lifting the prolapse anal. the hemorrhoid will sometimes cause something pop out of the colon, pop out the anal area and the drop and dead meat there. 芍药汤 can help to lift it, elevate it back to the body. Okay. Oh, no. Okay. This is for the general hemorrhoid. See? Oh. But something else. So,
Yep.
I can't get it out again.
You want to take it out?
No, the writing tools. Where
Oh,
are
you
they?
didn't select them.
Huh?
You don't select them. You didn't select the tool right there. Right now, you don't.
Oh, already on it. Okay,
Yeah, you have to select it first.
okay.
The bottom, you take it at the bottom.
So next subject is for pus, purulent. It's called something like I don't remember the name. Fistula. Fistula. There are a lot of dirty things like this. Let me make a drawing for you. Okay. This is the ass, okay? And this is the anus. The purulent will find itself some kind of a way outside to the surface of the skin. This is the S. The purulent will find itself a way here, make a hole, and all the pus will drink out. Very terrible. Something like this, terrible. And it can be a lot of them, just like a bee's net, and all of a pus. Purulent coming out of the ass. So the treatment will be a little bit different, but actually all this will do too. Actually, same thing. The only thing about the pus is when you have a pus inside the human body, you might have a little fever and the pulse will become faster, like more than 110 times a minute to show you there's maybe a pus in there. Usually we cannot ask a patient to take off his pants and let me take a look at your butt. But anyway, when you have this fast pulse, you might know he might have something like a pus inside and in a very terrible condition. You still can use my combination. It still works, almost the same. Okay. Can you give it to a nursing mother? Yes, we can. Okay. Any other questions? Once I did a very stupid thing in Taiwan. I put an ad in the newspaper. I said, if you pay, all you have to pay me once for how much Taiwan dollars, and I guarantee you in 1 year, your hemorrhoid will not come back attack you. If it does, I'll give you free medicine for 1 year. I was so confident of treating this kind of a problem. So I gave that announcement to the public. The reaction was very strong. My point is, if I don't have any confidence in myself, if the patient keep on coming for medicine for a whole year, I'll be losing a lot of money. I'll be damned, right? But I didn't. They just take once, maybe twice, every 3 months or something. Everything is gone with my Chinese medicine. At that time, I was using cooking medicine. But now we use this, I'm sorry, this one is very, very effective. You don't have to do any operation. You don't have to do something. They tied it up, all those dirty things on the ass, and to make it stop coming or whatever is dirty thing. I don't do that. I just take the medicine, everything will be just fine. Okay, any questions? Okay, no problem. 40. This is for the hemorrhoid, bleeding, swelling, bleeding, and pain. Okay. If the pain is really severe, this will take care of it. You can add a little bit of 乳香没药 and 普银 for the pain is acceptable. Okay. Okay, and since the ear is already there, let me do something for you. See that this area, the neck and shoulder is dark and popping out. So that means there's a lot of pressure on the neck. So this patient would definitely have neck pain or something and swollen. You can use my code breaker, heart breaker, or cyst breaker to break it. And see this area, this is the abdomen, a lot of dead blood. And see the wrinkle here? That's sleeping problem. We'll be talking about sleep combo later, okay? And this group means a little ischemia in the heart area. This redness means acid stomach inflammation. See this abdomen, this little swollen. And this darkness means inner ear. Inner ear means vertigo. You might get a lot of dizziness now and then. You can use my vertical combo. And this, see this area, you look from this. From this angle, it's inside, that's the breast. If a lady, one ear is red and one ear is brown color, that's very possible for breast cancer. And this is the hip, the back pain. But the different from this is see the swollen tissues popping out of the surface. That means something swollen in his neck, back area causing pain. You can use my astringent to deal with that. It's very effective. Okay. And the next one, okay. Oh, this is good. This is the stomach, something in the stomach. See the little balls here? That means skin allergy. And for this guy, the colon is all dark and collapsed. That means a lot of a dead stool in there. And with the inflammation around the anus area, and see the redness and darkness, inflammation and blood stagnation. And this redness means the back pain with the inflammation. And this is the abdomen hernia or something swollen. And this is the chest. And this is the hip with old injury and swollen too. You must use, definitely we use 乳香没药 and my cyst breaker or lump breaker, things like that. And this ugly stuff is the colon and with the old hemorrhoid because it's dark. Hemorrhoid is just like a vertical veins, same thing. And see the purple veins here? That's the knee joints, something there. And this is the neck and shoulder. This is the stomach. And this is the skin allergy. And this also the colon, polyps. See? The colon is so dirty. There's a Japanese guy, the scientist or something. He wrote a book about what's say English, the image of colon. He studied. He's a lab tech or something. He studied lots of thousands of endoscopic pictures. Said a lot of people have a very dirty colon. Not a lot of people, most of people. So that's the reason, the source of all disease. So he suggests a lot of probiotics to clean the colon, or some laxative to clean all the dirty things out. That's the best way to maintain health, by clearing the colon. And also it's a very good approach for maintaining a beautiful skin, okay? Colon can be very destructive. Interesting. Oh, this is the chest. And this line means sleeping disorder. And see this dark spot there? That's the inner ear causing the vertigo with the dead blood in there. Okay, the third one is the cough combo. And the fourth one will be the asthma combo. I really cannot tell the pause from bronchitis and asthma from the pause to tell the difference between them. But I do have a way of distinguishing to tell the difference between the asthma and bronchitis by touching here. How come we don't have? Can I see that? The spot here. You can touch your patient's this called REM 22. You touch it. It's very interesting. Sometimes it's freezing cold. I don't know why. Sometimes it's hot. If it's freezing cold, colder than the rest of the skin, like this area, is bronchitis. If it's hot, warm and hot, that's asthma. I don't know why. It's just like that. It's very simple. You with your fingertip to touch it, or you can use a thermal gun, temperature gun, something, feel it. If it's hot, it's asthma. It's cold, freezing cold or something is bronchitis. Okay? Okay, Sam. Do I take a black one if no bleeding? Okay, fine. Okay, for the cough combo, and with the, of course, with the some kind of phlegm. How do you know this is a phlegm? The right swing. The right swing always the place to find problem with the respiratory system. So why do I use 金防败毒散? 清肺汤、大青叶、马鞭草、Herbal ABX. Okay. The pause is like this. Do you remember my Yang Wei pause? I like to draw it this way, but anyway, it doesn't matter. This is the 8th extra meridian, Yang Wei, and this right swing is directly the lung. So Yang Wei can show you the nature of the condition in the bronchial. So if it's thick and shapeless and scattered, that means too much phlegm. So we must use something like astringent. It's not listed here, but you must use astringent to deal with the swollen tissues here. 金防败毒散. Why do I use 金防败毒散? Anybody can tell me? That's a question. What? Sorry, talk too much today. Why should I, what am I using 金防百毒散 here? Come on, it's a question. No answer. What? Heat. I already have so many medicine in there for heat. Wind, cold, dampness. Okay, anything else? Release exterior. 祛风解毒. Come on, Benjamin. Clear the lung. No, it's release the exterior. This one is correct. For the surface condition, exterior. Sometimes I use 银翘散, but not recently. I use 金防百毒散, but most people have dampness in their body and the cold wind attack to the respiratory system, because respiratory system connect to the nose, connect to the skin. It's the first defense line of a human body. So I use 金防百毒散 to clear the heat outside. If the patient is very weak and anemic, you can use the 桂枝汤 or 柴胡桂枝汤. 大青叶, this is all for 清肺汤, this is for cough, and 大青叶马鞭草 is very here. 大青叶马鞭草 is very, very good for bronchitis, for inflammation, and herbal ABX. You can choose any of them. You don't have to use them all at a time. So put them together. We are very, this combination is very complete for any kind of a cold and bronchitis, cough, and everything. Of course, the patient must stop drinking or eating anything cold. And I told my group member that it's winter time. If you want to eat fruits from the refrigerator or not from the refrigerator, you have to microwave for 20-30 seconds before you eat your fruit. Somebody feel that's kind of funny. Why? Because I don't want cold stuff inside your body. In Taiwan, they are, you know, those people, they're selling with a little card on the street. What? The baked sugarcane. For what? For cough. And you can bake an orange or something at your own home, about 30 minutes to 1 hour to bake it, then eat it. It's hot and little chocolate and something. It will help with the cough too. Bake it, huh? Really sick, yes. Okay, so this is for cough. So now you know how to differentiate cough and combo, and the next one, the asthma, by touching here, huh? Okay. The 清肺汤, or you can use 麻杏甘石汤, 麻杏石甘汤, or something. Let me put it down. SM. How do I type? Text, huh?
Yeah, text.
But we don't have ma huang in there, but it still works for open up the chest. There is a certain condition, I don't know if you ever encountered it before, that when you go to the doctor, hey, doctor, I have a cough, I'm fine. They will give you antibiotics automatically. So after taking that antibiotics, I personally experienced when I was young. You take the antibiotics and the cough suppressant, something like that, your throat will shrink, like I cannot breathe or something, because it's too cold, and all the treatments hasn't considered that still some exterior condition in your body, which you should solve that problem first before you take cold medicine. So the only result, I mean, the best way to release the tightness of your throat is the 麻杏甘石汤. So what I'm trying to say, if you catch cold or your patient caught cold or something, don't give him too much cold medicine, even the patient is asking, I'm coughing with a yellow phlegm. Be careful with the sequence. You should get rid of the exterior condition and then put little astringent and anti-inflammatory for the chest, for the bronchial. Okay. And the 顿寿散. Oh, I don't know how to spell that. Sorry. Anyway, all this, you can use astringent, huh? Astringent. Don't forget, my astringent complex is very, very effective. And of course, you must ask a patient, don't drink any ice water. What about pear soup? Okay, yeah, pear soup is not strong enough. Can I give this combo to my young kids? Yes, how much? What do you mean, how much? I don't even know how young your boys are. For people, for grown-ups, adult people, we use at least 3 or 4 times 8 grams for adults. For little kid, half of it. You can use able if you already use this all the combination, you might not use herbal. That's good enough. This 马鞭草 is a very interesting herb. I use it a lot in Taiwan. It's good for glaucoma, the high eye pressure causing the vision and stuff. 马鞭草. And also I use this for treating liver hepatitis, not necessarily virus hepatitis, just any kind of hepatitis. 马鞭草. Okay. Five and 2, I don't know. Okay, any questions now? Okay, let's get on with the next one, the asthma. Okay, it's about an hour. You want to take a break? Go ahead. I'm not going to. Let's get on with the asthma because I have something very new, absolutely revolutionary.
You want to take a break?
Nope.
2 seconds?
Are you going to change tape? Okay, sorry.
Keep going quick.
No problem. Take your time.